Before you start defrosting the turkey and finalizing that holiday menu, it's important to ensure that you and your loved ones are safe and healthy together. I was able to speak with pediatrician and mother, Dr. Saida Amna Hussein, who had timely tips for staying safe and COVID cautious. Take a look. Doctor, many people are looking forward to getting into the holiday spirit, and the excitement could make many forget about potential health risks. What are those risks everyone should be aware of?
Good question. And generally in the winter, viruses can really thrive. The common cold, the flu, because with the harsh, dry environments, the viruses can actually persist on surfaces longer. So we do see cases surge of the flu. We have seen in the past that COVID cases do actually increase in the winter seasons. So that's not to be forgotten. Not to mention, when it's cold, we are more likely to gather indoors. Indoors, crowded gatherings do increase the risk of potential transmission. And of course, if masks are down, we're not able to distance. Those are all really important things that do increase the potential risk and help us remain COVID cautious as we're weighing those risks.
That's good to know. And what are some ways families can remain COVID cautious as they navigate the holiday season?
Sure. So generally, I tell families as a pediatrician, if your child is eligible for the vaccine, get your child vaccinated, because we do know that's one of the safest ways to obtain immunity. Frequent testing, which we'll discuss more too, provides great data as well. So that's part of the safety approach and strategy to mitigate the risk. But let's not forget the other things that the CDC pointed out. So hand hygiene, those things very early on that we recommended in the pandemic. Mask wearing when appropriate, social distancing when you can. All of those things are very helpful.
So how can we remain COVID cautious if you must travel, especially with children who may not be vaccinated?
Sure. So traveling can be tricky. I usually recommend trying to go the path of the safest route. So car might be the best thing to do. That way you can really control who you're coming into contact with and really control your social bubble the best that you can, especially if you have a child who's not able to wear a mask yet. Now, if you do travel by plane, rest assured that the airflow through the cabin is pretty turbulent, pretty fast. So that does help when we're talking about how the virus is spread. But masks are mandated in airports and in airplanes. Other than that, try to distance when you can, and definitely remember hand washing. When it comes to testing, a great option is the BinaxNOW self-test that you can actually take at home and then take before you leave or when you return home.
And how will this test help families to remain COVID cautious this holiday season?
So testing is still an important part of the strategy. And again, I try to tell families that more data can be very helpful, especially if that data helps determine safety of decisions. So if you, for example, were to test positive and you can appropriately reach out to those who are close contacts, perhaps they were some families who don't have vaccinated individuals or vaccine eligible individuals yet. So testing can provide really good data and that peace of mind when making decisions not only for our own health, but the health of others. Now, Desiree, when you are trying to think about the testing, the great thing is that in each box, there's 2 tests. So we do recommend frequent testing to increase the likelihood of potentially picking up on a positive case. So you would test, let's say today, and then test at least 36 hours after the first swab, but within 3 days.
And Dr. Hussein, what should someone do if they develop symptoms after attending a holiday event and need to quickly determine if it might be COVID-19 or another respiratory ailment?
And that's a really fair question. So generally, it's really hard to tell apart. So what I recommend is that you reach out to your healthcare provider first. Your personal physician can see what your medical profile is, see what your history is, see if you have pre-existing conditions, and determine if you need to be able to be seen in the office or if you're somebody who might be a candidate for a self-test at home.
Thank you so much, Dr. Hussein. And for more information, visit BinaxNOW-selftest.abbott.com.